Welcome back to this Bayou Time segment. I'm Martin Falls, and on this segment, we're continuing to listen in and watch the governor of the state of Louisiana as he's talking about the Delta variant of the COVID crisis here in the nation. And let's go back and listen to the governor and see how he's wrapping up this segment on Bayou Time.
On the bottom left, you see the combo graph with the orange bars on the bottom representing percent positivity of all tests being conducted. As of this week, 13.2% of all tests being conducted are positive. That's the highest number it's been here since the first week in January. And the purple line above is testing volume. As you would understand, testing volume has gone up notably the past couple weeks, and we ended the month of July with over 500,000 tests being conducted. And of most concern to us on the bottom right, you'll see a graph representing the number of COVID patients hospitalized throughout the state. As of today, we are at 1,984 COVID patients hospitalized throughout the state. Our first surge in March, April 2020, we peaked at 1,991. Our second surge, which was about a year ago to date, we peaked at 1,600, which we've clearly surpassed now. Our third surge, which up until this surge was the largest one, Christmas and New Year's surge, we peaked at 2,069 hospitalized patients. We are on track to exceed that mark tomorrow. And I have every shred of confidence, unless something miraculously happens, that tomorrow we will have the largest number of hospitalized COVID patients throughout Louisiana than at any point prior in the pandemic. We are also seeing younger patients get hospitalized, and we are unfortunately seeing younger patients die with the Delta variant. The average age of COVID fatalities has gone down 10 years since the start of this year. It was 75 at the end of 2020, and as of this month, it's now 65. And more concerning than that, over the past month, the number of COVID deaths in individuals less than 40 years of age has increased 566%. That's 566%. I expect the speakers that follow me will share the challenges being faced by their hospitals and what that means for their patients and for the communities that come to rely on having quality care available when they need it. I'll tell you, this battle has shifted as the pandemic has gone on, and you'll remember in the beginning we were worried about PPE and ventilators. Thankfully, we have enough of those right now. We later were worried about physical space. The key limiting factor right now is human resources. It's staffing. And as the governor shared, this is a national issue. We're about 6,000 to 7,000 nurses short in Louisiana, even before this surge. And hospitals are having to ask much more of their medical and nursing staffs who are already very tired and stretched very thin. I want to be clear, this is primarily a staffing issue. We are short in human resources. To that end, we have made rather unprecedented requests to our federal partners. We've asked for federal assistance in the form of disaster medical assistance teams, or DMAT teams. The first one of those teams arrived in state over the weekend and is being onboarded right now. We will make additional such requests, but that is a very limited resource. And we do not expect the feds to be able to provide us all the staff that we need. It's also a rather extreme resource. You typically don't see these DMAT teams outside of extreme natural disasters, hurricanes, earthquakes, and so forth. To have a federal disaster medical assistance team on the ground right now providing staffing augmentation to a civilian hospital is quite the sight, quite the marker of how severe this situation is right now. Let's move on to the next slide, please. I wanted to review what we know already, and this is the result of 16, 17 months experience of this pandemic, some of those months being the leading state, I should say. At this point, it is unquestionable that universal masking has proven to be an effective strategy to reduce the community spread of COVID-19. Repeated studies have shown that when localities institute universal masking, they see the transmission of COVID-19 go down. Is masking perfect? Of course not. Nothing is. Will it prevent COVID 100% of the time? Of course not. Is it highly effective when employed at the community or statewide level? Absolutely. Absolutely. We also know without any shred of a doubt right now that vaccination significantly reduces one's chance of becoming critically ill or dying from COVID-19. From the best data we have right now, and again, with the Delta variant, data is coming in very quickly, and some of it from Louisiana itself, because we are really one of the leading edge states right now, if not the leading edge states. But from the best data we have right now, when you get vaccinated and you are fully vaccinated, you have a 25-time reduction in your likelihood of being hospitalized from COVID-19 and a 25-time reduction in your likelihood of dying from COVID-19. Vaccination confers immense benefits upon the individual who gets vaccinated.
All right, and don't forget, you'll see all of our programs. We've interviewed the parish presidents of Terrebonne and Lafourche on the COVID situation. You can watch all of these on Facebook, HTV's Facebook page, also YouTube, as we continue to bring you quicker, more concise segments on our new format, 7-minute segments across the board. You can view all of those as we continue to bring them out to you. And once again, we thank you for joining us, and we'll see you again on the next segment right around the corner.